In health news tonight, a new Connecticut law that could save you money on prescription drugs.
Plus, it's perhaps the #1 public health crisis in our country. We're talking about childhood obesity, and News 8's health reporter Jocelyn Mementi here to talk
Often,
about what's being
news coverage surrounding the declining health of more and more Americans is framed in a way that suggests the primary problem is the poor choices that individuals make, which contributes to their low quality of health. Differences in health status among vulnerable populations are not caused primarily by individual behaviors. There's a direct correlation between social, economic, and environmental factors and health inequality. Millions of people in the U.S. do not have health insurance, and access to healthcare services is limited. It is important for people to understand that it's not just about access. We have to understand the context of access to care and its relation to health disparities.
To gain more insight on health inequities in Kent County, we talked to some community leaders about the intersection between health and access to care, transportation and the environment, income disparities, education, housing, and racism.
We have seen a large growth in the numbers of people who are of low income but who can access health care in the last 15 to 20 years. But at the same time, we've seen far greater numbers of people going from a point of reasonable income to becoming low income. And so we're playing catch up. On the surface, it looks like we're providing more and more access. We are providing more access to more people, but there are more people out there who are in need of access. When access is very limited, quality tends to be limited as well.
We work with the Strong Beginnings program, working with pregnant women during pregnancy and then for 2 years after delivery. And close to 95% of our clients are African American or biracial, and most of them live at or below the federal poverty line.
One of the major contributors to health inequity is income disparity. Shannon Wilson talks about how the quality of one's health is often determined by income level.
Those in our community who share in the greatest wealth also share in the greatest health and health outcomes. And contrary to that, we know that those who share in the poorest health are often our most vulnerable populations. We see increased mortality in our lower socioeconomic groups. We also see increased morbidity, so those populations are getting disease at a much higher rate. We also see unhealthy behaviors in a lot of these populations, and so whether that be lack of access to healthy foods, lack of consumption of healthy foods, which is a lot different from lack of access, the lack of physical activity or adequate physical activity. We often see that in the lower socioeconomic groups or the less wealthy, as opposed to those who have more money, and that's for a multitude of reasons.
Having access to healthy foods is also about transportation options. Dave Bukowski with Disability Advocates of Kent County addresses this issue.
Looking at just basic transportation, can people get to, for instance, the farmer's market when we have, the freshest, most locally grown organic produce, but if I can't get there, and if I can get there, can I get the produce home? Just those two trips could be an insurmountable burden for folks. And then the convenience of, again, prepared foods, that it's just easier to purchase things in a box. And part of it as well then is looking at what kind of housing conditions people live in. Do they have the adequate, just refrigerator and stove? Again, a lot of us may take that for granted. With folks with disabilities, what kind of accessibility do their housing environments lend themselves to? So there's just, when you start layering those pieces in.
Tamber Bustance talks about why it is important to first acknowledge racism as a reality in order to address health inequity.
if we take a look at some of the latest data, for example, Unnatural Causes is a project that is kind of launched in 2008 and continues to make waves in communities all over the place. But it basically talks about 70% of Americans believe that we do not have any type of racial inequities right now here in the United States. 70% of Americans believe this. So if 70% of Americans believe that we have absolutely no problems in regard to racial inequities, then we really don't have a common denominator of validating that we have an issue, validating that we have some disparities and some inequities going on in this community and beyond across the United States.
It's well known that people of color receive poorer quality health care than their white counterparts. White people who have the same conditions, same socioeconomic status, same insurance level, and so on, that people of color are more likely to receive poor care. And then you have the embedded institutional racism, the racism that was built into our structures when they were created for the purpose of protecting white privilege. So, and those institutions continue to this day.
The first thing we need to do and understand is, in order to have health equity, we need to work hard at housing equity. Because as long as your housing situation influences your overall health, and as long as there are predominant populations and communities that don't have access to quality housing, we're always going to systematically perpetuate bad health outcomes. So quality health starts with quality housing.
We also heard from several people from the community who talked about their lived experience of growing up in neighborhoods where social inequities are more pronounced and how that contributes to poor health.
When I moved to this city 21 years ago, I moved to that street and I've lived there ever since. And I've seen a lot of things, and I've seen a lack of emphasis placed on healthcare. The top priority is just survival. Making it through the day, less stress as possible, making it through in one piece. And having a healthy lifestyle is a commitment. It takes time, it takes money, and it's just not something that is pushed in my community.
Don't have insurance. So because they don't have insurance, they can't go to the doctor for every time they have the sniffles, or their kids are have a little cold because they don't have the cash money to pay for it. So they end up waiting until it's really necessary for them to go to the emergency room. And I think because of a lot of temporary jobs that are being that they're doing right now, because they've taken so much away from insurance benefits, the temporaries don't offer insurance. And when they do offer insurance, you have to be in the temporary for about a year before you can get it, and then it costs you money. Well, of course, they can't afford to buy that insurance. The ones who are lucky enough to be on Medicaid or Medicare are not so lucky because they can't find doctors who will take them.
As I get older and I had to feed my daughter, I always wanted to try to pick the healthy choice for her. So that problem came where, if I can go into a store and get a bag of chips or some hot Cheetos that kids like, for 35 cents or 50 cents, but in that same store they have apples, oranges, or bananas or something for 85 cents, and I have to do this daily, of course, daily, weekly, monthly, the difference in the cost is going to be substantial.
These lived experiences should inform how we collectively address health inequities in our community. Some of the community leaders we spoke with also provided us with valuable insight on how to combat health inequities.
So the three things that I think that we need to achieve health equity here in this community, the first would be to validate the fact that things aren't fair, that we have an unfair healthcare system. I think the second thing that we really need to do is then agree to say we don't know what we don't know, that we don't have all the information, but we're at least willing to dig deeper to find out more. And then thirdly, I think what is really, really important, and probably the key thing, is that we need to encourage those and bring hope to those who have already made those decisions, that are already doing the work, that we need to continue to kind of stir up, fan the flames of what they're already doing, and encourage them to continue to fight.
If I were to identify 3 ways in which I think Grand Rapids and Kent County can really move the bar in terms of improving health inequities, it would be 1, to really align resources. I think this is such a resource-rich community that we can align resources and get resources to the point where everyone in the community is able to share in the great wealth of our community. I think we need to have honest and open conversations with the folks who have the power and those who do not. And so we're talking about the haves and the have-nots actually sitting at the same table and discussing these inequities that are existing in our community. And then finally, I think that Grand Rapids doesn't exist in a bubble. And so there are other communities across the country who are also dealing with these same issues and coming up with innovative approaches to addressing these issues. And I think we can take or learn a lot from these communities and bring that back and give it our own West Michigan flavor and really move the ball.
We have to get up and do something and make change. Change is that, it's changing. We cannot feel good that we have good intentions. We cannot feel good that we individually are great people. We must measure our success by impact. What impact are we having in a community? How are these health disparities declining? How is the high blood pressure rate in Black community going down? How is the diabetes rate in our Latino children going down? Our community is too bad off to just sit back and be good because we're trying or we're doing, we know we're individually good people. And I think it's redefining equity. I think it's redefining impact, and it's being willing to hold our feet to the fire. And we have a saying, data is friendly. We have the data. We know how to take care of some of these disparities. Shame on us if we're having this conversation a year from now.
We all must address determinants of health throughout an individual's lifetime. We can foster a community where people have a chance to reach their full health potential. Effective action to eliminate health inequities requires community dialogue, community engagement, and a commitment. Together, we will mobilize our community to achieve health equity and social justice. Here's what the Deputy Administrative Health Officer, Bill Anstey at the Kent County Health Department, had to say about our commitment to this work.
One of the goals of the Kent County Health Department is to make sure that our staff is very culturally competent when we're delivering our services. How we're going about achieving that is we're going to have all of our staff go through mandatory training over a day-and-a-half period. The training will be a day-and-a-half long, where they can have discussion, learn some of the terms, be made more aware of the social determinants of health. In fact, this is such an important factor that the Public Health Accreditation Board, which will accredit local health departments on a national level, requires local health departments to prove that they have culturally competent staff delivering culturally competent services to the residents that they serve. So it's recognized as an important item from the national level right down to your local level here at the Kent County Health Department.